Good morning, everyone. Today, we are gathered here for World Breastfeeding Week 2026. As we all know, the theme is breastfeeding for a sustainable start in life, strengthen what works. I welcome you all to this event, the students, residents, faculty members, and Pandya sir. We'll be beginning the program with showcasing of reels. We had a reels competition, and the topic was nourish the mother, nurture the mother, nourish the child. And we had active participation from all the residents. I would like to invite Dr. Sonali to take this forward and share her experience.
Good morning to one and all. So this World Breastfeeding Week 2026, we had a very engaging, interesting and showcase of academic, knowledge in a very creative way. So I'm very happy with the entries which we had. Hello, Dr. Kruti ma'am.
Yes, hello.
Hello ma'am, good morning.
Good morning.
So we are just briefing the audience about the reel making competition, the experience, the whole part, like what we did and how it all. So we had a
Sure.
good taste of like the academic creativity, and we had very good response. So we got to see a different facet of pediatric residents this time. We had in all
Yes.
six entries, which were there for the seven entries
Seven entries.
seven entries for the competition, which were judged by like judges with different calibers. We had Kruti
Correct.
ma'am, okay, and we had one more judge. So I would like Kruti ma'am to just announce the winners. But before that, we would just see all the reels together at one go. Is that so? We'll watch one by one.
Hello, doctor. As we are celebrating World Breastfeeding Week, would you like to say something regarding that?
Hello everyone, I'm Dr. Saib Sheikh. This World Breastfeeding Week. Let us consider one simple truth. When we nurture a mother, we nourish the entire generation. The child first home is not fed up, it's mother's milk. The child first nourishment starts even before the first drop of the mother's milk. Caring for the pregnancy with the folic acid filter, correcting nutritional deficiencies, managing chronic illness, supporting women's mental and emotional health lays the foundation for the healthiest pregnancy and a possible healthier start for the baby. During pregnancy, every nutritious meal, every peaceful moments, and every act of kindness contributes to the healthy growth and support brain development and strengthens the baby future. Then comes birth, and with it, nature's greatest gift, the breast milk. The breast milk supports the growth, strengthens the immunity, supports brain development, and create a lifelong bond between the mother and the child. Every mother's breastfeeding journey is unique. Some experience pain while feeding, cracked nipples, engorgement of the breast, low milk supply, fatigue, stress, or anxiety. They don't need judgment. They need understanding, guidance, and support.
But doctor, how does homeopathy help?
And with homeopathy, we provide each woman an individualized and a holistic approach that supports the mother's emotional and the physical well-being, and we understand each mother as a unique individual. We carefully evaluate symptoms, her temperament, her constitutional types, and the factors that make her complaint better or the worse. Based on this complete individual picture, the medicine is selected according to the fundamental principles of the individualization. The goal is not to relieve the local breast complaints, but to support mother overall health, restore balance.
Nature nurtures every living being through its five elements: space, water, fire, air. Just as nature is the cradle of life, mother is baby's first world. Before everything, the child knows the mother. Breastfeeding is more than nourishment. Gives emotional security between the mother and the baby. Yet this beautiful journey is not always easy.
Pain, exhaustion, sleepless nights, anxiety, and self doubt often accompany the breastfeeding mother. As homeopathic physicians, we understand that breastfeeding is more than a physical process. We care for the mother and her baby as one unit. Every mother's journey is unique. Through individualized case taking, counseling, and appropriately selected homeopathic remedies, we strive to support maternal well being and promote a healthy breastfeeding experience. Healing is never the mother's responsibility alone. Every word of encouragement, every helping hand, every moment of compassionate care strengthens both the mother and the child. Nature teaches us that every life flourishes when it's nurtured. Our compassion nurtures the mother and nourishes the child. Sometimes the best way to heal the child is to first hold the
Nature teaches us that every newborn deserves nourishment, protection, and love of mother's milk. Mastitis and breast abscess cause severe pain, fever, and reduced milk flow. Mothers hesitate to feed, babies receive less nourishment, and the beautiful bone of the breastfeeding is interrupted. Homeopathy supports breastfeeding by addressing the mother's condition. Remedies like belladonna, phytolacca, and silicea are selected according to the individual case to help mothers recover comfortably. When the mother's pain reduces and breastfeeding becomes comfortable again, the baby receives what nature designed best, that is, mother's milk. Breastfeeding is not just about feeding a baby, it is about building a healthier future. And here's why this simple fact shows why breastfeeding matters. A nourished mother feeds more than hunger. She feeds humanity, comfort, growth, and love. Nurture the mother and the child flourishes.
who is our patient, the mother, the child. In homeopathy, we see the mother and child as a one nurturing unit. Their health, their bond, and their journey are deeply connected. Before birth, the baby receives life and nourishment through the umbilical cord. After birth, this connection continues through breastfeeding, the baby's first source of nourishment, comfort, and protection. Homeopathy supports this bond by caring for the mother through holistic individual care. A mother's nutrition, health, confidence, and emotional well-being influence the breastfeeding journey. Therefore, supporting the mother is essential for nurturing the child. We listen. A homeopathic physician begins by listening. We understand the mother. Every mother is unique. Her emotion, her health, her challenge deserve individual care. We strengthen breastfeeding. We encourage correct breastfeeding practice, provide counseling, reassure mother, and support them throughout their breastfeeding journey. Individualized homeopathic care. When appropriate, individualized homeopathic treatment complements this holistic support. This smile is just beyond a magical moment. It is a reflection of a nourished child, a confident mother, and a bond fostered through a breastfeeding. Because we nurture the mother, we nourish the child.
Mother's milk is not only for the nourishment, but it is baby's first bond, comfort, immunity, and foundation for the healthy growth and development. Every drop of mother milk carries protection, warmth, and love for her baby. The world sees a mother as caring, comforting, and nourishing, but few see what motherhood asks for. For many women, breastfeeding is natural, but learning to breastfeed is journey. Some mothers may experience sore or cracked nipples, breast engorgement, and concern about milk supply. Alongside these challenges comes a silent question. Am I making enough milk? Is my baby satisfied? Stress, anxiety, self-doubt, and exhaustion can make this journey even more difficult. Homeopathy doesn't see only the symptom, it sees the woman behind it. her body, her emotion, her individual experience. As a part of comprehensive breastfeeding support, individualized homeopathic care may help to ease her discomfort and support a mother's well-being. Breastfeeding is not only about the nourishment of child, it is also about caring for the woman who makes this nourishment possible. When she feels heard, supported, and cared for, she embraces motherhood with a greater confidence and comfort. Because every nourished child begins with nurtured mother.
A sustainable future begins in a mother's arms. Every child deserves the best start in life, and that journey begins through breastfeeding. By not only nourishing the child, but nurturing the mother and strengthening the support system around her. Hello, I'm Dr. Pratiksha Mittal, and I would like to share a heartfelt message, not as a doctor, but through eyes of a newborn baby. Dear mother, before I opened my eyes, I already knew your heartbeat. Before I cried, you held me close. Before I tasted anything, nature prepared the perfect nourishment, that is your breast milk. But I know this journey isn't always easy. Sometimes you're tired, sometimes you're afraid, sometimes you wonder, am I enough? And sometimes the world makes it even harder. Your milk isn't enough. But, dear mother, please don't lose hope. You doesn't need judgment. You need someone to listen, someone to guide, someone to reassure you, and someone to teach you right position, right latching, and confidence to believe in yourself.
We don't have Shravani here, but this is done by Dr. Shravani.
Hello everyone, this is Anjali Singh, MD Department Resident at MLDMHI. As we celebrate World Breastfeeding Week 2026, we often talk about the importance of breastfeeding for neonates and babies. In this video, I will talk about breastfeeding and also the effect of it on the new mother and also need for the nourishment of the mother and also for the child. According to WHO, a newborn should be breastfed till 6 months and followed by solid foods with breastfeeding up to 2 years of age. Mentally and physically, breastfeeding can be quite challenging for a new mother. There are a lot many changes that significantly happen during breastfeeding and also during pregnancy. It's also important to educate the mother about breastfeeding and counsel them about the three changes that are going to happen. So many problems can happen, such as cracked nipples, mastitis, breast abscess, calicosis, There are homeopathic medicines which are safe to use during pregnancy. Homeopathy can effectively be given in conditions such as insufficient milk syndrome, retracted nipples, sore nipples, breast engorgement, and also cystitis. We also talk about conditions such as postpartum depression and anxiety. So homeopathy and counseling with secondary counseling helps in curbing better future for mother. So stay safe and stay healthy.
Here, I would take the opportunity to introduce our privileged judge for the reel making competition. We had Dr. Kruti Dirwani with us. So let me introduce her. She is a consulting homeopathic physician and a clinical nutritionist with 15 years of experience. She has her MD homeopathy degree along with MSc in dietetics and clinical nutrition and is a certified onco nutritionist. She is also the co-founder of Sunshine Homeopathy Clinic in Mumbai and has also authored a best-selling book called the author of Millets, the Trending Ancient Grains, and a renowned speaker conducting workshops on nutrition and wellness. Above all, ma'am is also a member of Techno Medics, which we are which we have for the social media reels related to our college. So ma'am has got an expertise in this reel technical guidelines. She will guide you and let ma'am, can you just share your experience with these reels, how it was, and the judging phenomena, and the winners, of course.
Good morning, everyone. Thank you so much for this opportunity. Judging this reel competition was a little tough because, as we can see, that all of the participants had content wise, each one of them had put in a lot of effort and they made it complete. Everything was covered, right from why breastfeeding is important, how is necessary for the mother and the child, what are the complications that the mother goes through, and how homeopathy can help. So each one of you completely uh, stuck to the theme and you were complete in the content wise. So then the judging came where how you have used the creativity, how you have used the technology in this. So the final winners that we uh, decided were based on this. A lot of you have used creativity in different forms. Some of you use digital media, you use images, you use clip arts, which makes it more demonstrative. So as a viewer, it becomes easier to understand what you're trying to say. Some of you have used your own creativity, like one of you have made charts, which was also very good. You have made handmade charts, which shows the creativity of the doctor there. Uh, some issues were there. Some of you had your background music a little louder, so your audio was not coming through clearly. So that was one issue, that yes, whenever you're making a reel, make sure that the background music is lesser in volume and your voice stands out. Two, whenever we are taking multiple shots, make sure that they look seamless. When you join back those shots, they have to look seamless. So either you can add a transition or you can add a overlay image so that when your scene is changing behind, it doesn't look jerky. Otherwise, the video looks a little jerky. So that is one thing. Uh, I think yes. Otherwise, all of you did a very great job. So I'll just make the announcement of the winners. We'll start with the uh, third place. The third place goes to reel number 5, Dr. Sejal Jain. She used a lot of images, though they were made by AI, but the images spoke well, especially the woman showed with different emotions and what the mother goes through during breastfeeding. So she depicted it very well with the use of good images. So, and overall, a very complete video with importance to homeopathy also covered very well. The second place go to Dr. Thamarai Ravishankar. Again, very well thought of when you started with those 5 elements in your video. Good. One more thing in her video was that she did give the video courtesy from YouTube, from where she had taken the video, so the copyright issues are not there. And also, she blurred all the the patient's faces, which is a very important part. That whenever we make a reel or whenever we are putting something out on social media, we need to blur keep their identity secure. So whether it's a report or whether it's a face, you have to blur it. So she did that. She completely covered all of that. And the first place goes to reel number 4, Dr. Divyani Desale. She was the one with a lot of creativity used. She made a lot of charts, a lot of hard work put in. So great job, everybody. So I enjoyed watching it and I enjoyed seeing through all the different criteria. Thank you.
A great time seeing a different facet of our MD residents. It was a very unique experience for us. So I will hand over the mic to Dr. Jayashree to take the session ahead.
Sir, ma'am, we have Pandya sir also. Pandya sir? Sir, unmute yourself.
Good morning to everyone.
Yes. Sir, ma'am, as you were the judges, Pandya sir were all sponsors of all the prizes. So we are really thankful to sir for his generous gift to us. As last year also, sir had gifted us for this competition. So I would like to call all the winners, and we will distribute gifts, and then we will take a pic with them. Yes, please come forward, all the winners.
So the third prize, as we all know, is Dr. Sejal Jain. And the second prize goes to Dr. Tamirai Ravishankar. Prize goes to Dr. Divyani Desale.
Thank you, Pandya sir, and thank you, Kruti ma'am, for being there with us. Thank you so much.
Hello, 1 minute, 1 minute.
Yes, sir. Yes, sir. अभी मैं यही बोलने वाला था.
I want to give one more gift to Dr. Sheikh because he is the only male doctor who has shared his views with the rest. So I will give him this book, the book which was there, on the third prize. So I will send this book to him. I will send this book to him.
Thank you, sir.
To Dr. Sheikh because he was the only a male person. But I want to tell you one more thing. All the reels were very good. But if you see all the 7 or 8 reels which were there, if anyone can pick up everything, little things from each reels and a complete one reel, which will be 100% one reel, because there are so many. These all reels are not completed. They are missing something or they have some extra thing in that. So if someone can take this task to make one reel from this, that will be much more better and it will complete the topic.
Yes, sir.
So if
Yes, sir, definitely, sir.
Okay, thank you.
Thank you, Dr. Says, very well done. Can we have a view?
Yes.
Can we have one book?
I have one. Hello, I have one book. I will send him. Please share me his address. Pardon?
For the photo.
For the photo, sir. We are taking one photo.
Homeopathic treatment of children. I will gift him.
Yes, yes, sir.
By Dr. Paul.
जो हाथ में वो सही नहीं जो हाथ में वो सही नहीं
उसके पास बॉल हेड्स क्यों है कौन सी है?
थैंक यू सर। ये सर से आई हुई है ना।
हाँ, तो उसके नहीं, उसके पास है तो मैं, और उसको जो जो नहीं है, मेरे पास बहुत सारी बुक है, उसमें से मैं एक दूंगा
हाँ,
उसको।
ठीक है, कॉल करेंगे सर। थैंक यू वेरी मच सर।
ओके ओके, सी यू सी यू।
So thank you, Dr. Kruti, and thank you, Dr. Sonali. We are off to a great start now. Let's move on to the main event of today. We have with us our guest speaker, Dr. Swapnaja Nagle. She is going to speak on breastfeeding for a sustainable start in life, advances in human milk science, clinical breastfeeding support, and role of homeopathy in lactation care.
Hello.
Hello, ma'am.
Yeah, hello. Hi.
Can you hear me?
Yes, I can hear you.
Yeah. So we have ma'am has joined us. So let me introduce you to our guest speaker today. She is Dr. Swapnaja Nagle, a proud alumni of MLDMHI. She has completed her BHMS from DS Homeopathic Medical College. She is an associate professor of Department of Obstetrics and Gynecology. She did her MD in Pediatrics from MLDMHI, and she has been a lactation consultant and a practicing homeopath for the past 8 years. And she's passionate about guiding parents and empowering new mothers with comprehensive breastfeeding support. So we're glad to have her with us today. And madam, I would like to let you take it forward from here.
Yep. Thank you. Thank you for inviting me. So I'll share my screen.
Yes, yes, you can share. I will stop sharing. I will give you permission for that.
Okay. Okay.
We can see your screen. You can go in slideshow mode.
Yes, you can. Is it visible?
Yeah, perfect.
Okay. So first of all, thank you very much for inviting me as a speaker on the occasion of World Breastfeeding Week. And good morning to all the
Dr.
faculty
Swapnaja.
members and the students.
Dr. Swapnaja,
Yes.
can you put on your camera? Is it on? We are not able to see.
Yeah, just a second.
Yeah. Yeah. Thank you.
Yes, is it visible?
Yes, ma'am. Thank
Yeah,
you.
okay. So, like I said, thank you for inviting me, and it is a privilege to be speaking on the occasion of World Breastfeeding Week. The theme this year is breastfeeding for a sustainable start in life and strengthening what works. So, the theme reminds us that breastfeeding is not just a method for infant feeding, but it is one of the most powerful, evidence based, and sustainable public health interventions which is available to us. So, before a newborn receives the first vaccine, before the first prescription, and often before the first medical examination, the newborn receives the first breastfeed. So, this single act provides nutrition, immune protection, warmth, comfort, and bonding. So, as pediatric residents, you are uniquely placed in beginning of a child's life. So every time you attend a delivery, examine a newborn, counsel the mothers, or even assess a growing infant, you have the opportunity to either strengthen breastfeeding or unintentionally undermine it. So your words in the first few hours of birth, they can influence feeding practices for months and sometimes even years. So in today's session, we will be discussing about we'll go beyond the breastfeeding slogan,
Dr.
and we will
Swapnaja.
be discussing about advances
Dr.
in human
Swapnaja.
milk. Yes.
I think slides are not moving. Just
Yeah.
check once. Now they are.
Yes, yes, yes. So in
Yes.
today's session, we'll be discussing about physiology of lactation and composition of the human milk, describing how breastfeeding supports infant immunity, gut microbiome development, and the gut-brain axis. We will be discussing current recommendations and guidelines, and also discuss about the role of homeopathy in lactation care. So why are we talking about breastfeeding? Like I said, it is the first nutrition which the baby receives. Breastfeeding is unique because it provides nutrition, protection, and attachment. It is like the first vaccine, first immunization, because breast milk contains live immune cells. It contains secretory IgAs, which enhance the immunity and which also helps in gut maturation. It is the first emotional bond between a mother and the baby. Okay, and it is also known as the first public health intervention because it is the earliest, universal, low cost, and highly effective action that protects the newborn as well as the mother from the very first hour of life. Okay? And it is the most effective way to ensure child health and survival. So, why breastfeeding matters, we can see from the reviews, from the data given by the National Family Health Survey. So, as you can see, the rate of initiation of the breastfeeding has increased from 41.8% to 50.1. So, this is a good encouraging progress, but still we need to understand that still half of the infants are not able to breastfeed within the golden hour, within first 60 minutes after birth. And as a pediatrician, here our role comes in to educate the mother and the family about the importance of breastfeeding and early initiation. Also, the exclusive rate for breastfeeding for the first 6 months has decreased from 63.7% to 55.8%. So this is it requires attention, and here we need to identify the causes which are affecting the exclusive breastfeeding rates. And as a role, as a pediatrician role, we can hereby empower the mothers, and uh, we can definitely encourage her to breastfeed more, right? So for a successful early initiation of breastfeeding, crawl is the best way. I would like to share a video here of breast crawl. Are you able to see the video?
Yes, ma'am.
As the answer for early innocent babies.
No, Dr. Satnaja.
Which will colonize.
Hello.
Yeah, are you able to see the video?
No. You may have to do some adjustment or use entire screen. Share entire screen. Stop sharing, then you can share entire screen.
Okay, just a second. Yes, is it visible now?
Now, yes.
Is it visible?
Yes.
Baby is also kept warm, being in close contact with the mother. Baby is also prevented from future infections because
Volume is low, a bit low.
Okay.
Volume.
Thus, this position ensures early instinctive
Okay. Let it be.
warmth, love, security, and also food. It also initiates bonding process between the baby and the mother.
So here the newborn was immediately placed on the mother's abdomen, and he was quite alert immediately after delivery. So
Kids will give tender food jerks to the stimulating it to contract. This will help to expel placenta and reduce bleeding. Once baby realizes that food is in close proximity, it starts salivating. Smell is a strong stimulus which drives the baby towards the nipple. Baby's smell sensation is well developed. Smell of a chemical on nipples is similar to the smell of a chemical in amniotic fluid which surrounds the baby in the womb. Mouthing movements start. Her shoulder, hip, and neck muscles are sufficiently developed to help her move. Baby with her limited vision can see the areola. If baby raises her head, it can also see mother's face. Baby has reached the nipple, has raised her head, and has nicely lashed it with wide open mouth and mouthful of breast. What a beautiful moment of joy for the mother and the child. This baby has reached the destination in just over 10 minutes. Majority of babies will successfully complete breastfeeding in about 30 to 60 minutes. Like all other gifts of nature, this comes free of cost. However, the health and nutrition benefits offered
Yes, screen sharing is stopped.
Yes, so this was a beautiful
Continue
video
with the
about
present.
breast crawl. So coming back to our presentation. Yeah. So I'm sure after seeing this video, the residents will want to give an opportunity for the baby to breastfeed in the labor room, delivery room itself. And yeah, are you able to see the presentation?
Yes, ma'am.
Yes.
And please on your camera as well, ma'am.
Yeah, yeah. Yes, so what is breast crawl? That is every newborn, when placed on the mother's abdomen soon after birth, has the inbuilt reflex to spontaneously crawl to the mother's breast and take its first breastfeed without any need for assistance or prompting. So the quality of spontaneous latch by the baby during breast crawl is perfect. This is because the baby is most alert during the first hour and it seeks eagerly for the breast for feeding, after which the baby might sleep because of the stress of labor. And also because of the positioning of the baby, the effect of gravity, the tongue falls out naturally and that ensures a good latch. So breast crawl or early initiation of feeding is also helpful in thermoregulation. It prevents hypothermia because the mother's abdomen, it acts like an incubator for the baby. It is helped to improve the blood glucose levels, and it also improves the gut microbiota because as the baby crawls on the mother's chest, all the healthy microbiomes on the mother's chest, they get into the gut of the baby. Okay, and it is also seen that if babies are fed in the initial first hour, in the golden hour, they cry less. Okay, early initiation is also beneficial to the mothers because it helps in increasing the oxytocin levels, so thereby making the uterus contract and reduce the risk of postpartum hemorrhage. And it also ensures better bonding with the baby. So there are different breastfeeding positions which you can advise to the mothers depending on her conditions. But the important points to note while breastfeeding is that the mother should be comfortable in whichever position she is feeding. So her back and her feet should be well supported. Her baby should be tucked close to her mother, ensuring that the baby's chest and the mother's chest, they touch each other. So the baby should be facing the mother, right? The nose should be directly in front of the nipple, and chin should be touching the breast, and we should support the baby's neck, and it should be little extended while feeding to ensure a good latch. So this ensures that the baby has opened its mouth wide enough to latch onto the nipple and the areola. Okay. So at the same time, while breastfeeding, there should not be any dimpling of the cheeks or any clicking sound, and the mother should not complain of any nipple pain during feeding. So this ensures that the latch is perfect. Okay. Now, how to make sure the baby is sucking, baby is latching well, how to make sure whether the milk is getting transferred to the baby or not. So very important point to note about the urine output. I'm sure all of the residents, while taking the rounds, they must be asking the mothers how many times the baby has passed urine in 24 hours. So it is an important indicator whether the baby is getting adequate feeds or not. So in the first 24 hours, the baby should have passed at least one time urine, and the amount of urine passed, the times of urine passed should increase as the baby increases, as the baby's life increases. So for example, if the baby is 3 days old, he should have passed urine 3 times in 24 hours, and the frequency of urine gradually increases. So by day 6 onwards, the baby should be passing minimum 6 times urine in 24 hours. Okay, this ensures that the baby is getting milk effectively. Another indicator is the weight gain. So all of you are aware that babies lose weight. About 10% of weight loss is normal in the first 7 days of life, and gradually after first week, the baby starts gaining weight, so that by second week the baby should have at least passed his birth weight. Okay, and consistent weight gain is an indicator of effective milk transfer. So while we are speaking about breastfeeding and lactation, it is important to understand the anatomy and physiology. Uh, like you all know, each breast has about 15 to 20 lobes, and each lobe contains small lobules, which contains clusters of glands known as alveoli. So these alveoli are milk producing units, and it is surrounded by the myoepithelial cells, which in response to oxytocin, they contract and eject the milk. And there are lactiferous ducts which connect the alveoli to the nipple, so they transfer the milk from the alveoli to the nipple, right? There are also Montgomery's glands on the areola, which secrete a lubricating oil which protects the nipple from chafing during breastfeeding. Okay. So what is lactogenesis? It is a process of developing breast milk and occurs in 3 phases. Phase 1 is of secretory initiation. So it generally begins around 16 weeks gestation and continues until the birth of the baby. So here the high levels of estrogen and progesterone helps in growing milk ducts and preparing the mammary glands. A thick nutrient-rich colostrum is produced during this phase. Okay, but because of the action of high levels of progesterone, the milk flow is inhibited. Okay, in second phase, which is known as secretory activation, it begins around 30 to 72 hours postpartum, and here after the delivery of the placenta, the progesterone levels drops down, and because of this the prolactin hormone acts freely to produce milk. Okay, milk comes in, that is transitions from colostrum to transitional milk with a heavy increase in volume. So typically during this phase, during second or third day of post delivery, the mothers will experience chest tightness, they will experience some engorgement in their breast. Okay, and phase 3, known as galactopoiesis, it begins during 9 to 10 days postpartum, and it lasts throughout weaning. This is mainly maintained by the effective milk removal and frequent breastfeeding by the newborn. Okay. Here the mature milk comes in, which consists of foremilk and hind milk. Okay. So now we understand the oxytocin and prolactin hormones are important for lactation. So what exactly happens is when the baby suckles on the nipple, so the impulse goes from the nipple to the hypothalamus to through nerve pathways, and the hypothalamus then signals the anterior pituitary gland to release prolactin hormone. This prolactin then acts on the alveoli to produce milk. At the same time, hypothalamus also sends a signal to the posterior pituitary gland to release oxytocin. This oxytocin acts on the myoepithelial cells and they contract and eject the milk. So prolactin is known as milk production hormone. There is the prolactin surge. It generally happens during night time. So it is important for feeding effectively at night as well to maintain the supply. And oxytocin hormone, it is known as the milk letdown or letdown reflex or milk ejection reflex. So this oxytocin is triggered not only by the baby suckling on the breast, but it is also triggered by even hearing the baby cry, by seeing the baby, or even thinking about the baby. Okay, whereas it is inhibited by maternal stress, pain, anxiety, and fear. So we understand that the mother's mental state, it also impacts the physiology of the milk production and milk ejection. Then there is also a concept of feedback inhibitors. So when the breasts are full and mother is not able to breastfeed effectively, these feedback inhibitors of lactation, which is an active protein, they send signal to the brain to stop milk production. So that is why it is important for the mothers to feed frequently, at least 2 to 3 hours, every 2 to 3 hours in a day. And also night feedings are important because if there is infrequent milk removal, there will be less milk production, whereas frequent milk removal will lead to more milk production. So lactation, it depends on the principle of supply demand principle, that is more suckling by the baby, more prolactin and more milk production. When there is more effective milk removal, higher the milk production. Whereas less suckling, milk is accumulated, the effiles get activated, and there will be reduced production. Okay, so why this is important to know? Because especially mothers of NICU babies or preterm babies, wherein the breastfeeding is not initiated or the babies are not able to breastfeed actively. So in those mothers, we advise pumping to effectively remove the milk so that her supply is maintained. Okay. So clinically, we understand that there can be delayed lactogenesis in LSCS because of delayed early initiation of breastfeeding, delayed skin to skin contact because of the maternal pain and stress. And as a role, and as our role is to our role as a pediatrician is to ensure that there is early initiation and effective breastfeeding. Night feeds are important. So every time we counsel a mother to feed the baby during the day as well as night time. And some cluster feeding is also important. Cluster feeding is where the baby feeds frequently in short group of hours. And some mothers may experience that the baby is feeding or demanding feeds continuously, and she may think that she has low milk supply, so that is why the baby is demanding frequently. But you need to counsel her and ensure that that is not the case. Cluster feeding can occur during growth spurts wherein the baby gains weight rapidly or there is some development of a new milestone, so that during that time the baby might demand more milk, and this in turn is beneficial because it will help in increasing the milk supply. So moving on to the human milk, components of human milk. So like I said, human milk is nature's living medicine. It contains all the nutrients in the right amount, in the balanced amount. It contains the living immune cells. like leukocytes, macrophages, which helps in fighting of the pathogens. Then there are also beneficial bacteria known as human microbiome. So these are mainly bifidobacterium, lactobacillus, streptococcus, staphylococcus. So they help colonize the newborn's intestine, they promote intestinal maturation, strengthen the gut barrier, and reduces pathogens colonization. So this in turn reduces the risk of infections, reduces risk of diarrhea, and also NEC in preterm babies. Then there are human milk oligosaccharides, which is complex sugars and which are found. It is the third most abundant solid component of the human milk after lactose and lipids. So HMOs are not directly absorbed by the infant, but they feed the good bacteria, and that it acts as a vital prebiotics and protects against pathogens. It also provides immune support by strengthening the gut barrier. Okay. Then breast milk also contains cytokines, which are anti-inflammatory and pro-inflammatory. So anti-inflammatory cytokines like IL-10 or TGF-beta, that is transforming growth factors, they regulate the gut inflammation, prevents excessive tissue damage, and prevents allergies. The pro-inflammatory cytokines like IL-6, IL-8, they act as chemoattractant to fight off the pathogens. Okay. Then there are certain stem cells present in the breast milk which migrate into the infant's circulation and differentiate into various tissues. They help in organ growth and repair. Okay. Certain growth factors are present which promote growth, maturation, and repair of the GI mucosa. So these are commonly insulin-like growth factors, epidermal growth factors. Then breast milk also contains hormones like leptin, ghrelin, cortisol, thyroxine. So leptin is important because it signals satiety, whereas ghrelin is a hunger hormone. So these two hormones are important because they reduce the risk of childhood obesity. So that is why we know if when a baby is exclusively breastfed, so it reduces the risk of childhood obesity and diabetes in the later years. Okay. So we understand breast milk contains all these components. Now we'll move on to this slide wherein we will understand how the immunity is developed by human milk microbiome with the help of HMOs. So an infant newborn is born with all the components of the immune system. It just requires a stimulus to activate its immunity, right? And this stimulus is provided by the microbiome present in the human breast milk. So when these beneficial bacteria they enter into the gut of the newborn, so what they do is first of all they'll uh, occupy the attachment sites and they will start colonizing. So when the good beneficial bacteria start colonizing in the gut, it prevents the other pathogens from colonizing, okay, from growing rapidly. So this is why the risk of diarrhea, pneumonia, and other infections it reduces, right? Second thing, the microbiome it stimulates the maturation of the intestinal epithelial cells and makes the junctions tight. So you can imagine the gut as being a wall, and the breast milk it prevents the wall from leaking out. So when the junctions are tight, when the barrier is tightened, the pathogens, the harmful pathogens cannot enter into the lumen of the intestine. Okay. Then these beneficial bacteria, they feed on the HMOs, human milk oligosaccharides. So they ferment the HMOs and they produce short chain fatty acids. So these short chain fatty acids, they nourish the intestinal cells, they reduce the inflammation, they support the mucosal immunity, and they also interact with the nerve pathways. Okay, that is why this is breastfeeding is so important because it uh, triggers the immunity and improves the immune function, right? So the human milk microbiome they also educate the human cells, that is the signals from these microbiomes they interact with the gut associated lymphoid tissue and they promote the regulation of T cells and balance the immune responses. So breast milk helps the immune system in learning what is harmful and what is harmless. Okay. So initially it was thought that the brain of the infant, it grows on its own, but research has shown that breast milk and the gut and the brain, they communicate with each other. So the breast milk, like I said, it contains healthy microbiome plus HMOs. So these they ferment the HMOs and produce short chain fatty acids. So these nourish the intestinal walls. They interact, they affect the neural signaling pathways, and this pathway is through vagus nerve and the microbial metabolites. So they help in developing the brain by influencing the myelination, synapse formation, the neurotransmitter systems, and they also help regulate the sleep and behavior patterns of the infant. So it is shown, research shows that the babies who are breastfed, they have a higher cognition as compared to formula fed babies. So when we speak of formula, we should understand the difference. Even though the formula and breast milk, they contain the same calories, but breast milk contains living immune cells, whereas in formula there is no living cells. There is limited addition of the HMOs, and the maternal antibodies are absent. There is no natural milk microbiota, right, and limited bioactive components. Also, human milk is dynamic in composition, that is, it is individualistic. Every mother's milk will be different in composition depending on her diet, her environmental, social status, and also her genetics. So that will all influence in the composition of the human milk, whereas the composition of formula milk is fixed. Okay. So breastfeeding has benefits not only to the mother and the baby, but the benefits also, uh, it also benefits the family and the society in general. So speaking about infant benefits, immediately it will reduce, help in reducing the mortality. It increases the survival rates. It reduces the risk of infections like pneumonia, diarrhea, UTIs, and also helps in reducing the risk of NECs in preterms. Long-term benefits for the child is reduced risk of childhood obesity, diabetes mellitus, some allergies, asthma, and improved cognition and educational outcomes. Immediate benefits of the mother includes oxytocin release, so it will help in contracting the uterus. It reduces the risk of postpartum hemorrhage and improved bonding with the baby. And long term benefits are, it reduces the risk of breast cancers and ovarian cancers. It also provides a better birth spacing, and it lowers the risk of diabetes. So when a baby is uh, exclusively breastfed, it lowers the expenditure on infant feeding, on formulas, on the bottles. Then with the bottles, it comes the sterilization equipment. So all these cost is reduced. So that definitely it helps the family. And also there is fewer hospital visits because of the less infection risk, and because of this there is less parental work absenteeism. So it also benefits the family and the society as a whole by reducing the healthcare cost, by lowering the environmental impact, and with improved population health. So major organizations like WHO, UNICEF, American Academy of Pediatrics, IAP, they all recommend exclusive breastfeeding, and they have given guidelines as to how to successfully breastfeed. The common message from all these organizations is that there should be early initiation, that the babies should be breastfed in the golden hour, that is within 60 minutes of birth. Exclusive breastfeeding is advised for the first 6 months. What does exclusive breastfeeding means? The baby should not be given any water, honey, guti, or any other thing apart from breast milk for the first 6 months. Breastfeeding should be continued for 2 years or beyond, along with the complementary solid food, which is age appropriate. And it should be family centered breastfeeding support. So breastfeeding is not just the responsibility of the mother, but the partner and the family also play an important role for the mother to successfully breastfeed her baby. So all the major organizations, they recommend these important points. Only in IAP, the Indian Academy of Pediatrics also recommends vitamin D supplementation for breastfed infants and iron supplementation according to the national recommendations. Okay. Moving on to our theme, which is breastfeeding for a sustainable start in life. So sustainable means which is remains for a long time. So breastfeeding gives every child a healthy, equitable, and sustainable start in life. It is safe, clean, and contains all the specific nutrients which a baby requires for the first 6 months. It is a complete food for the baby. It protects it also protects the maternal health, like we have seen in the previous slides. It reduces the healthcare expenditures and supports the healthier communities. So there is no any manufacturing cost or any packing or transportation required. So it also reduces the carbon footprint. Okay. So it benefits the baby, mother, society, as well as the environment. We already know what strengthens the breastfeeding for a successful breastfeeding outcome. So we also know we are discussed already the benefits of early initiation, of immediate skin to skin contact, exclusive breastfeeding. So we need to know how to strengthen what works. So as a pediatrician, as a homeopathic pediatrician in your pediatric wards, you can empower the parents, you can educate the mothers about their the success, about the importance of breastfeeding, and you can also you can also tell them the importance of breastfeeding and listen to them about their choices. You can help the babies to breastfeed early. Often you can identify the early hunger cues of the babies, and so that the babies are fed on demand, and you can trust their natural ability. So breastfeeding, like I said, it is the responsibility of the mother, the family, and the society as a whole. So by involving families and partners, they can provide love, help, and protection to the mother. So if the mother is emotionally well supported, she'll definitely breastfeed for a longer time. So we cannot strengthen breastfeeding without the help of skilled care. So we also need to train our nurses in the hospital and train the professionals so that they can identify early intervention, identify challenges, and uh, give early intervention and guide with compassion. So breastfeeding has to be uh, promoted. So by following proven practices, by connecting the common parents, by building up peer groups and community networks, a mother feels more supported, well supported in her journey of breastfeeding. We need to create breastfeeding friendly hospitals, workplaces, and society wherein the maternity rights are supported and facilities are provided so that we can normalize breastfeeding everywhere. So together we can strengthen breastfeeding and give every child the best start in life. So as a homeopathic pediatrician, we cannot dismiss the importance of homeopathy in lactation care. We have a concept of individualized case taking. So we know that every mother is different, and with this knowledge, we can take this knowledge to consideration. We can take the mother's mental state, and we know that the mother's mental state, it affects the production of lactation, and accordingly then we can choose the remedy which can be given in the cases. So maternal emotional support is also important. So as a pediatrician, as a homeopathic pediatrician, our role is not just to provide homeopathic medicine, but to also support the mother emotionally. So whenever you're taking rounds, you can just simply ask how the mother is doing. You can show some compassion, some empathy. You can ask about her difficulties and ask about her well-being. So this definitely will increase her confidence and she will want to breastfeed more. Okay, homeopathy has a good role in treating low milk supply, in breast engorgement, in sore nipples. And along with the evidence-based breastfeeding support, we can definitely improve the breastfeeding outcomes with our remedies. So I would like to discuss a case of low milk supply. So the case was taken in 2020, almost 6 years back. So the patient was 32 years old. She came with the complaints of low milk supply since 4 days. She had recently traveled from her maternal house, and while she was traveling, she was pumping to feed her baby and noticed that her output has suddenly decreased, right? And also, her baby had fallen sick when she was at her maternal place. And in general, the patient was very much anxious and tensed about the baby's health. She was anxious since the birth of her child because the baby had been given phototherapy because of neonatal jaundice, and since that she was very much anxious and about her baby's health and very much concerned about his weight. So the other history was the patient's diet was good. She was already taking shatavari with milk, and she had no major illness, and she was not on any medications apart from iron calcium supplements. Very striking feature of that female was as soon as she entered my cabin, she was like, I'm very much tensed about my baby's health, and his weight is not increasing, and he is sick. And so instead of giving her complaints, she was more focused on her baby. She was more worried about her baby. So in her history, it was seen that this was her second baby. The first one was 4 years old male, and she was able to successfully breastfeed till 15 months of age. And her second baby was 3 months old with a birth weight of 3 kg, and optimal weight gain was seen during these 3 months. And prior to this 4 days, she was breastfeeding comfortably, and only during these 4 days, because of the traveling and the stress of the baby's health, her milk output was decreased. So she noticed, like while pumping, her output has suddenly decreased. So on examination of the breast, there was no signs of any engorgement or no pain seen. Even the baby was assessed, the oral assessment was done, so there was no tongue tie or lip tie. The baby was able to latch properly. So taking into consideration the sudden low milk supply without any obvious cause, laccan was given as a single dose, and breastfeeding counseling was done to counsel her on demand and to have a proper diet. After 1 week, the patient noticed fullness in her breast, and also her output had increased. At the same time, she felt more confident while feeding, and her anxiety had also reduced. And later on, she was able to exclusively breastfeed for about 6 months and continued breastfeeding for 15 months along with the complementary food. So, in this case, it shows that remedy is also important, but at the same time, how a physician counsels the patient, that is also important thing. The mother, they are very much worried, and already they are going through a lot of hormonal changes. So just few words of compassion from a physician, they will increase their confidence and the choice for breastfeeding. So lastly, I would like to say, like, we need to protect, promote and support breastfeeding. Human milk is more than nutrition, it is a complete food. It shapes lifelong health, and the benefits also extend to the mothers. Every pediatrician has a critical role because he is the first one to observe the baby and assess the breastfeeding positions and latch. And breastfeeding, it gives a sustainable start in life. So with this, I would like to end my presentation. Thank you.
Thank you, ma'am, for that insightful presentation. You gave us a brief knowledge about theory, and also illustrated it through the help of the case, and shared how it's also important to alleviate the mother's anxiety and make sure both the mother as well as the child is taken care of, and the role of homeopathy in improving lactation. Now I would like to ask the audience if they have any questions. Please feel free to ask, ma'am. Yes?
Morning, ma'am.
Good morning.
I just want to know that can we give vaccination to mother during lacting period? Means like COVID vaccine is
or any other vaccine to be given to the mother?
You're
Is
not
there,
very audible. Can you speak a bit loudly?
ma'am, just I want to know that can
Hmm.
we give vaccine to mother during lactation, like COVID vaccine or anything like a mother is having a dog bite? Can we give rabies vaccine to the lacting mother?
Vaccination is a very interesting topic to discuss for homeopaths. In my practice, I've seen definitely it is safe to give, and we cannot undermine the importance of vaccinations. So you can vaccinate even if the mother is lactating and feeding her baby.
Okay, ma'am.
Thank you, Dr. Pawan. Anyone else? Okay. Now I would like to invite Dr. Nikita, our HOD, to share her few insights on the presentation.
Hello all. Thank you, Dr. Swapnaja. It was a really wonderful presentation. Before we move ahead to the next part of presentations, we have a few cases which will be presented by the residents. But I would like to really thank you for a really, really comprehensive presentation that you just made. We had a wonderful overview of the general concepts of lactation, breast crawl, physiology of milk synthesis, the hormonal understanding of how lactation occurs, the importance of various rules like early initiation, the various techniques, the latching. Your PPT wonderfully covered how a pediatrician should, really have the proper knowledge, skills, and the correct attitude, and how this becomes one of the important entrustable professional activity for us when you are working in the IPD. Madam gave very nice clinical pearls, which you can use directly while you are handling the NICU mothers in your day-to-day practice. So, this whole understanding of the theory and how you bridge it with the practice. Ma'am's case was also wonderful experience of how integrated knowledge of homeopathy being a good lactation counselor. Now, ma'am has done a proper course in it. We all can definitely do it if we want. But at least even this knowledge and understanding what are the basic postulates of how a correct counseling can, solve half of the problems. The remedy comes next. The first thing is how empathetically, so the right attitude, right? Now in the EPA based NCH curriculum, we have a lot of emphasis on how you should, communicate to the new mothers. So the case very beautifully shows that even an experienced mother, see, she is a G2, yet she needed that confidence. Now understand how a new mother, just a G1, and we have certain mothers who are even younger than your age. You all are almost 25. There are females of 18 years, 19 years in pain, having LSCS. So, that empathy will, because otherwise it becomes a routinistic activity that we have a lot of NICU mothers, they are there in our step down, we become a little, routinistic. But then that empathy will always help you. Each new mother has her own set of unique personality, how she adapts, how she handles. So if you have that empathy and with this lot of knowledge which ma'am just shared with us and with the right skills, I think you can all handle and become lactational experts without a degree also, right? So thank you, ma'am. Your case very nicely even focused on the specific galactogogues which we have in homeopathy, apart from Ayurvedic like Shatavari. So lac caninum, ricinus, lecithin, these are all specific galactogogues given in our therapeutics used by the stalwarts. Now, our beautiful team of our residents will start the presentation. Ma'am, would you like to say a few words for our residents, because we are coming up with 3 cases now, which will show
Okay.
the role of constitutional remedy in increasing the lactation output in cases of hypogalactia, and also managing the sick neonates with that. These residents are very, very dedicated, very sincere, and we asked them to prepare 3 cases in 48 hours. And they
Oh,
all have put in all their heart and 200% of efforts to come up with the cases. We also have Dr. Nandini Jadhav with us. She is our ex-MO, and she is a lactating mother herself right now. So I'm very proud to that she is also going to join us. She is very much part of these cases, and she is the one who has, nurtured all these people also, not less than a mother, probably. She was a strict MO, but I'm sure she has, taught you a lot of things. So before we move on, ma'am, would you like to share anything? Then we'll move on to our residents' presentations.
yes, definitely. Thank you for the kind words, Nikita ma'am. And I'm truly grateful and honored to be invited as a speaker by Alma Mater. It is a privilege to connect with my teachers and the institution through this platform. I sincerely thank Goda sir, Nikita ma'am, Omkar sir, and for their guidance and support, and for giving me this opportunity. And I'm really happy to be a part of this meaningful academic event. And I would really like the students to understand that it is like you said, it becomes routine while taking the rounds, but when you know the exact science behind the breastfeeding and the lactation, then the how you will counsel the mothers, that also changes. So there were many points which I wanted to include in the PPT, but because of the time constraints I had to cut down on my slides. But it was a very good experience interacting with you all. Thank you very much. Thank you.
Thank you, ma'am.
Yeah, thank you. So yes, so let the team please come in. I would like to invite Dr. Pooja Shah, Dr. Vrushali, Dr. Vaishnavi for case 1, Dr. Nandini for case 2, and for case 3, Dr. Tamarai, Dr. Pratiksha, and Dr. Sejal. Can we have a round of applause for these very, very hardworking residents? The stage is yours. Ma'am, please be with us for these 3 cases.
So, a very good morning to everyone. So, as we know, the theme of WHO this year. What is the theme, everyone? Nurture the nourish the child. For right. So, we are taking this concept ahead and relating it with homeopathy right now. Okay. So, the today's title is Role of Constitutional Remedy in the Cases of Hypogalactia. Okay. So what all we are going to see? Can you change the change the order?
Just check this thumb right camera.
So, objective of today's presentation is to understand the concept of mother and child as a unit, to demonstrate the role of individualized constitutional remedy in maternal anxiety and lactation with the help of cases, and to study the effect of mother and neonate separation along with the maternal and neonate factors on the breastfeeding and the express breast milk in the mothers with hypogalactia. And also we'll understand the role of susceptibility and its effect on the PNEI axis in hypogalactia. So, have you ever thought why constitutional remedy is needed if we are treating a neonate and a mother as a unit? Anyone? So we'll see this, why constitutional remedy is needed. Okay, what happens to the mental state of the mother before, during, and after pregnancy, and what is the impact of separation of mother and neonate in NICU on lactation. Okay, so all these will be shown through 3 cases. The first case will be starting with the first case. So, Dr. Vrushali and Dr. Vaishnavi to take over the case.
So let's proceed with the case. This is the case of preterm female neonate who is born with cesarean section, having gestational age 30 weeks. The neonate has very low birth weight, which is 1.270 kg. Neonate had respiratory distress, recurrent apnea, and desaturation, for which the neonate kept on ventilator. Also, neonate had neonatal jaundice, for which phototherapy was given. Neonate was away from breastfeeding for 12 days. So the suffering of mother is a 29-year-old multigravida who had bad obstetric history. So the bonding between neonate and mother is not established because of immediate separation from between mother and neonate. Anxiety and emotional distress of mother was seen. So expressed breast milk only was 12 to 14 cc till the day of 13. Painful expression of milk and reduced milk secretion of the mother. So we arrived at the final diagnosis, that is for neonate preterm very low birth weight with respiratory distress, and for mother is hypogalactia.
So further we'll explore the life space of the mother. We'll see it in 3 events, that is the childhood, marriage, and the current state. So during the childhood, she had faced a lot of financial hardships, due to which she had to leave her school in her 9th standard, which led her to work in farms to earn a little amount of money. Later on, she developed fear of darkness, fear of being alone. After marriage, when she got married, she adjusted well and to the new married house. She was calm, and there was a lot of suppression of emotions which led to crying alone. She had love for children and longed for motherhood. Um, Due to previous bad history of bad obstetric history, it led to deep trauma and development of anxiety. So during and in the current state, when the baby was in NICU, so in that state there was constant fear of losing the baby because of the bad history, and fear of staying alone. And also she needed reassurance, constant reassurance was needed. So the totality which was considered was anxiety about children's health, anxiety about future, weeping on past disagreeable events, fear of darkness, fear of being alone, bad obstetric history, and motion sickness. So the 2 close coming remedies were Calcarea carb and Sepia. So the final remedy prescribed was Sepia on the basis of anxiety about her children's health, bad obstetric history, and anxiety about future. So the final remedy given to the mother was Sepia 200. So this is the follow-up, which we can see in the format of a graph. Sepia was administered, after which we can see there was increase in the lactation of the mother. Initially, she was able to express only 12, almost around 12 cc's of breast milk, which eventually increased, which we can see in the format of the graph. So this was the case 1, followed with the case 2. Will be taken by Dr. Nandini.
Hello. Hello.
Yes, ma'am.
Case 2. The condition of neonate is very low birth weight. Weight is 1.2 kg. Female neonate with hypoglycemia and neonatal jaundice. Phototherapy was given in NICU. 22-year-old primary gravida mother with anxious, anxiety and emotional distress due to the reduced milk secretion. EBM only 2 to 4 cc till day 8. Fetal edema is present. The final diagnosis is neonate preterm very low birth, 1.2 kg weight with neonatal hypoglycemia. Mother diagnosis is hypogalactemia. The life space of mother childhood average in study fear to the go on stage and perform in school event does not mix with easily with stranger used to help her parent in farming marriage does not used to stay anything to elder and in current mental state gestational period happy and mentally healthy even while narrating the complaints he was happy and smiling. No worry about the neonate, even did not see the neonate for 3 days. Nausea from smell of food, 3 plus, and craving sour food, 3 plus. Totality, indifferent to child of her own, 3 plus, does not mix easily, 2 plus, responsible, 2 plus, nausea from smell of food, 3 plus, craving sour food, 3 plus, thermally chilly. The final remedy of mother is Sapia 201 PHS single dose given. The follow-up of mother before homeopathic medicine given, the mother was 2 cc to 4 cc only breast milk. After homeopathy given, the mother milk is increased up to the 14 cc. And also with neonate, the neonate weight also increased and the hypoglycemia also increased. Okay.
So the next case, case 3, will be presented by Dr. Sejal, Dr. Pratiksha and Dr. Thamare.
Now let's proceed with case 3. A case of mother with a full-term twin pregnancy delivered by cesarean section. Twin 1 had birth weight of 2.5 kg. A healthy neonate required no intervention. But the twin 2 had a birth weight of 1.5 kg, low birth weight neonate, later developed neonatal sepsis and required NICU admission, where integrated treatment was started. Integrated treatment was started with homeopathic medicine and homeopathic. As mother was with twin 1 in another hospital where delivery took place, and twin 2 was admitted in NICU of a hospital. This prolonged separation from the baby lead mother to anxiety. As this was the twin pregnancy, there was an increased demand for the milk, but the milk secretion was inadequate to meet the demand. Final diagnosis for the neonate, it was full-term low birth weight neonate with sepsis, and for mother, it was hypogalactia.
So now we'll explore the life space of the mother. So the childhood, it was a difficult childhood. Her mother died at 8 to 9 years of age. She had to left the school to shoulder the family responsibilities, and she has to suppress her own wishes. And that's why she continues to long for maternal support. She eventually says now that if my mother would be by my side, it would be very comforting, especially now. Then in marriage, it was an arranged marriage. She got married at 18 years of age. She spoke about the husband. He was very caring and supportive husband. She says that she is very sensitive, weeps easily, and was better by consolation. Even during argument with husband, she used to uh, weep very easily and was very sensitive to harsh comments. It was a then the pregnancy state. There was first pregnancy was uneventful. The second, she had experienced 2 abortions, and then the third twin pregnancy. So that in during pregnancy there were fear of pregnancy loss, and then after pregnancy also she was very concerned about neonates. So she was not visiting the twin 2 baby as she would felt that twin 1 will get affected. She would weep in NICU also, and there was persistent fear of losing hope, which was better by company. So very close coming remedies which were coming was natramune and pulsatilla.
So we have differentiated with the symptoms that the sphere of action, mammae and mind. The pulsatilla covers more the female genital urinary tract. Ailments from grief, and in pulsatilla there is emotional grief, but they usually express their feelings openly. But in natremure there is silent grief, and they dwells on past matters. The weeping, which was better by consolation, which was covered by pulsatilla, and in natremure, weeping, which is aggravated by consolation. There was great concern about twins. They desire company, which was covered by pulsatilla, and the lactation decreased. The scanty milk was better covered by pulsatilla. Hence, the final remedy, pulsatilla, was prescribed. Pulsatilla 201 pHs single dose to mother, and pulsatilla 0/1 OD for 5 days to neonate. So we can see on 10th day the pulsatilla was released, and we can see the significant increase in express breast milk, that is from 10 to 15 ml till 30 to 40 ml from 10th day of life. And the increase in weight also is markedly seen in this case. So yes.
So I hope all of you saw all the 3 cases. So does anyone want to say what did you understand from all these 3 cases? What were the similarities and differences? Do you want to point out something? Because we all are residents at NICU, right? So do you want to just point out few similarities? Because see, we have seen the beauty of homeopathy in all these 3 cases. The first 2 cases were of sepia, right? But did you see the presentation? One had indifference to the mother, and the first case was so much attached to her babies, right? So even 2 sepias are not alike. And even in third case, you can see that bad obstetric history. It is present in sepia, that is in case 1. And in case 3, bad obstetric history is there in pulsatilla as well. And these 2 are also different. So I think that is the beauty of individualized homeopathic case taking. And did you see that the breast milk production not only increased, it also increased the weight of the baby, right? And in case 3, when integrated management was provided to the baby with acute remedy, I think the basic complaints were addressed with an acute homeopathic remedies along with allopathic medications. The susceptibility of the neonate and the susceptibility of the mother, which got affected because of the anxiety that she had and the impact it created on the soma, the way it affected the psychoneuroendocrine axis, that is markedly improved in all these 3 cases, right? And as NICU residents, we are actually blessed to see that in real life, because we cannot, there are a lot of questions that we are asked. Why all these, what is the effect of psych on soma, right? So we residents see it on day-to-day basis. We all have 2 on-calls, right? So we can see mothers lactating, how they are anxious, and how it affects the lactating mothers, right? So we can see, we all have seen, I think you micro juniors have also witnessed right now in your recent times. So this has also been supported by our stalwarts. See what Dr. Hahnemann has to say. He says the medicine in aphorism 284 of Organon of Medicine, 6th edition, he says the medicine administered to the mother often acts also upon the fetus. So this is not just now, even 200 years back he has mentioned that. And lectures on homeopathic philosophy by J.T. Kent, he's saying the nursing infant is but a part of mother and 2 are one economy. So even Kent has mentioned that. And taking it forward, our Dr. H.A. Roberts, he has also mentioned the principle of art and cure by homeopathy. The infant, right? The infant is an extension of mother's vital force. So what are the take-home lessons that we say, okay, just keep this aside. What do you understand? What is your take-home lesson? Just 1-2 point, a very heartfelt interaction, anything that comes to your mind. Does anyone want to say something after your NIC posting? Anyone from here can say. Okay, fine. So what the first thing is that mother and child both function as one unit, right? So it supports not just the mother, but also the neonate. And the individualized homeopathic remedy that we have seen in all these 3 cases, it helps address maternal anxiety and support lactation. So mother neonate separation is associated with reduced breast milk in hypogalactia cases we have seen, and in even more cases where we have given a lot of galactogogues, which like laccaninum, lecithinum, which has also increased the breast milk production. But if we see later in the further follow-ups, in 1 or 2 follow-ups that we have seen, the impact that a CR has is a bit, it is proportionately a bit decreased compared to the individualized remedy that we are giving. It does provide relief, I'm not saying that, but when we see a mother, we just don't see her breast. We consider the person as a whole, right? And then the PNI axis, it provides a framework for understanding the relationship between maternal mental state and lactation. And a deep acting individualized homeopathic remedy of mother, it helps to stimulate the underlying susceptibility in mother child unit. Okay, so we would actually heartfelt thanks to all the mothers of the NICU patients who shared a lot of experiences with us, who shared their personal life story, who agreed to the individualized homeopathy case taking, and to all the residents. Since a very long time, we have all been very compassionate with the mothers in NICU, and to the nursing staff who they note down every small detail. Even we miss, the sisters are the first person to tell uska lactation kam aa raha hai, can you please see. So they mention and they tell us, because we have a lot going on in our heads. So they are our first heroes. And then the neonatologist are Sudesh sir, who has also provided us this platform to provide an integrated management where we give homeopathy as well as allopathy. He has allowed us to witness it firsthand. And Department of Pediatrics we are extremely grateful to them for providing us this platform to present all these cases. And then the principal sir, he was the consultant of all these cases, so we heartful thank to him. And Nikita Mehta ma'am, thank you for staying up late and giving us a lot of inputs, because the first thing that we all discussed was NIC and NICU, there are a lot of factors to consider. Is what she said to us the first time when we came in an ICU. There is a mother sitting in an ICU, a step down, she is feeding, someone comes in and goes out of an ICU, and then her twin or her baby is in an ICU who is really, really sick. And then there's pressure from her in-laws, there's pressure from her husband. She has to understand all these factors. So I think she threw a lot of light on understanding the person as a whole. So thank you for making us understand all this now. And then last but not the least, all our residents, all our NICU residents, we all have a huge applause to all of us. We have a huge applause to all of us. These cases and all these cases, we all have worked, Dr. Pawan, we all have worked on all these cases. So a heartfelt thanks to everyone. So before holding, in my reel, I have said that before holding a baby's hand, I think you should hold the mother's hand. So thank you.
Thank you, residents. That was amazing. Now I would like to invite Dr. Omkar to deliver the vote of thanks and conclude today's program.
Thanks. So it is my privilege to share vote of thanks with all of us, and also would like to thank first of all our speakers, Dr. Swapnaja Nagle, ma'am, Dr. Nandini Jadhav. Both have agreed very readily and easily to share their experience with us for this occasion. One thing common in both is both are lactating mothers. Dr. Swapnaja as well and Dr. Nandini also. So they, like in our institute, we have action learning principle, right? So they had knowledge and they already been through the journey. So they were able to explain and share with that intensity as well, that which I could reflect.
As a father.
As a father. And I also. So I am Saif. We were both are there contributing in some way. Sorry. Means the way gender wise that he presented the real, he represented the fathers in the all the mothers. Sorry, in the presentation competition, right? So they very beautifully shared and this journey, and through their knowledge they presented their own cases. And then I would like to thank our principal sir, Dr. Bipin Jain sir, Dr. Prashant Damboli sir, our director, for giving us permissions, our vice principal, Dr. Sachin sir, Dr. Vivek sir, for giving us permissions to conduct this program. I would also like to thank Guda sir for their constant guidance throughout the process. Till the last moment, sir was leaving to his leave. Then for real competition point of view, I would like to thank all our participants first, because they participated and hence everything happened. Then our sponsor Dr. Pandya sir, and which he also readily agreed, as last year he again readily agreed that this time we discussed and we had a concept. Last time we had shared stethoscope, so we thought this time we will select prizes as gifts, as books which are there in our syllabus. So sir also very said okay immediately for that. Judges, Dr. Kruti Nirvani ma'am, our external judge, and Dr. Bhavik sir was also judge from our side, internal judge, right? Also, our speakers, 2 speakers I have already shared, and our other speakers, Dr. Pooja, Dr. Tamarai, Dr. Rushali, Vaishnavi, Pratiksha, Sejal, under the guidance of Nikita ma'am, and others, our office team. We would like to thank JP Bhau and his team to help us coordinate this function. And last, our faculty, we all, Nikita ma'am for constantly giving us support, guidance, and being in the field, and Dr. Sonali ma'am for managing the real competition, preparing the MCQs which you are going to give post test. Jayashree ma'am for being the master of the ceremony, the main anchor, and last, all of us who are there and will also do it actively, consciously in our wards, which we have learned today. And with this word, I would like to share that our program has ended. Thank you. And if I have missed anyone, all Avishkar and other team also, which helped me, Pranav and other team, which helped me to make arrangements before the session also. Thank you.